Ladies and gentlemen, now we have a personality in the room who represents almost half of the health workforce, 29.8 million nurses. Last week, exactly a week ago, I was celebrating International Day of Nurses. Congratulations, Dr. Pamela. And we decided that, how long we will keep talking about nurses being the backbone of the healthcare system, when they will become the front face of the healthcare system. And that can only happen with leaders like you and taking technology and giving them. We started the world's first course on digital health for nurses, and we are so excited. I have seen that nurses are not only committed to the patients, but to the profession and transformation of healthcare. We are keenly looking forward to hearing your views.
It's really a pleasure to be here with you, to be part of this conversation. I think the title, Digital Health Without Borders, is really a great way to look at how we must revolutionize healthcare around the world. And I have a second hat that I wear, which is as co-chair of the UHC 2030 Steering Committee. So I want to share a few comments with you about digital health and the importance of achieving UHC, but then really share what's near and dear to me, which is the role of nurses and how you may not have thought about the pivotal, not just role, but impact that nurses are having in terms of digital health. So some would tell us that digital health is actually a shortcut toward universal health coverage. And I think what's really interesting is that when we look at low and lower middle income countries, they have an opportunity right now to leapfrog over all the mistakes that we've made and the poor investments that have been made in high income countries over the years. Now, at the same time, there's a benefit to look at the development of technology, and we know that's a pretty rapid pace. But also because we've seen that development, we've seen the pricing gone down. And so we I think, have a great opportunity to look at the democratization of technology that can be placed everywhere. And we know that again, we want to see the digital health transformation occur in every single country. Because by using technology, we can provide better and faster healthcare to more people. That may have been already described by several other speakers before I got here. But it's also empowering for our patients. Just as, I think has already been pointed out with the diabetes population, it's more efficient for providers, and it's also more cost effective. Now, in some countries, it's been difficult to want to make that shift because the old economic models don't apply. And so I think that there are countries that are falling behind because of wanting to hold on to old economic models. And that will change, I'm sure. It's just going to take time. But digital technology, as we know, brings care closer to the patients that we serve. And so we can then have connected communities. And this whole issue of again, democratization of digital health and technologies is really connecting individuals to their providers, to the resources in their communities. And it has started years ago with cell phones. And so being able to have very simple technology that now is the way that people can access healthcare. And also a lot of advancement that's being made in terms of broadband and the use of telehealth. That whole constellation of how do people access and use technology are the digital determinants of health. I don't know how frequently you're using that terminology, but that has to go side by side in parallel to saying what are the applications that we're using in digital health, because upstream of that is how are people accessing them? What is the availability? So we know that digital health has both technical systems and social systems. And it is in both of those realms that nurses operate. When we talk about the digital determinants of health, nurses are usually the ones that are saying, tell us where you live, tell us what the capabilities are, tell us the resources that you have for you and your family. Because it's important that we understand what is that access. The second piece of that, which again I know all of you know, is digital literacy. Not only do our healthcare providers need to have a step up in digital health literacy, but we owe it to the people in our communities to make sure that they also have that same digital health literacy. Now I'm pleased to say that 2 years ago, the International Council of Nurses passed a position statement that we have been using widely on the digital transformation of nursing care in health. And I'll just share a little bit of that content with you. Again, we want to recognize the critical role that nurses play in positively shaping digital health, make sure that they have the support and resources to lead digital transformation. Nurses need to be involved in decision-making, just as we say our patients at the community level need to be involved. We should not be eliminating what is the major part of our workforce. We also want to align digital health technologies with patient and nurse safety. Because when we think about what's happening in our higher tech environments, technology can be used for good, it can be used for bad, and it can have safety implications. We also know that nurses are very creative and innovative and are behind the development of a lot of technologies, both for use in acute care settings, but also there's been amazing development of applications that nurses are using with populations, with youth to reduce smoking and drug use, with pregnant women to make sure that they have a safety net if they've got questions, to be able to use different ways of looking at helping people with impediments or any kind of handicap that they can. Nurses have developed apps for people who can't speak and can't hear. So there are all kinds of ways that nurses are on the development end of looking at how can digital health, again, expand the access to healthcare. We also know that there's a bias. Predominant 90% of nurses are women, and people think, wow, women don't know tech, and we know that's not true. And we know that in many of our other fields, medicine is in a lot of the high-income countries, 50% are women. In pharmacy, a high percentage of women. Same with our professional therapists. But nursing seems to have to get over that stigma. But what we know is that nurses, in fact, are asking to be enabled to participate more in digital health. And in surveys, we've shown that 70% say they want to be more involved in a data-driven healthcare environment. And so that collaboration between the enablers of tech, our colleagues in other professions, and then also looking at nurses really being tuned into health equity and making sure that our patients have access is really critical for us. Again, they're working with AI-driven systems and platforms to make sure that people are connected. In some of the low-income countries, nurses are on that sharp end of data collection that are monitoring patients with non-communicable diseases. They are in our rural communities, making sure that those connections are there. Again, it is amazing when we look at the continuum of technology and all of those touch points. We have nurses dealing with both the technical and the social aspects of supporting our patients. Now, one of the things that was mentioned too is trying to be able to infiltrate our primary healthcare environment. And this is one where, when I mentioned sort of leapfrogging with technology, it's also true that countries that treat prevention as the most important part of healthcare, as the fundamental role in primary healthcare, also are truly benefiting from the implementation of technology in terms of screening, in terms of tracking, in terms of recognizing that it is technology that is a digital health that's enabling us to be able to look at working on the root causes of illness, as well as being able to stay upstream so that we're not treating just an illness-based system, but really a system that's focusing on health. So I would just close by reinforcing nurses have a critical role to play, not only in the transformation of healthcare and digital health, but really redefining how we work together within our communities, how we push together for achieving universal health coverage across that continuum, and focusing on how it is that digital health is an enabler and can accelerate what we do, and really recognizing that we must put digital tools in the hands of not just our providers, but the people that we serve, and together within that ecosystem, make sure that everyone is involved in identifying what are the needs, what are the access points, what are the skills that are needed, and that we deliver on that together so that we raise the expertise across the board. Thank you.